I'm Dr. Richard Shaffer. I'm a consultant oncologist and I specialize in radiotherapy for benign, so non-cancer conditions. So I guess my inspiration for becoming a doctor was my grandfather. He was a GP in Cardiff, and I just saw how he was so much part of the community. His patients loved him, and he loved his job. You know, he used to talk about it a lot. It really was his life, and I was a great admirer of my grandfather. And when I was in school, really, I enjoyed science, so it sort of made sense that I would go into medicine. So it was really a sort of inspiration plus the practical side. The reason why I chose oncology is it was really just a good blend of the practical stuff, the technical stuff, and the emotional stuff. And so, you know, the obvious thing is that people who have cancer are distressed. It's perhaps the most difficult part of their life. And just, I'm quite a calm person. And so I actually find that that's quite a good place for me to be involved in people's life when they're finding things difficult. And I tend to find that I can calm things down quite well. So I just sort of enjoy that initial contact. I'm quite a logical person, and it makes sense that I would be in that sort of part of the journey. Regarding what I actually do, I just found cancer very interesting in terms of the concepts involved, in terms of how things develop, how things spread, and the different challenges that people have. Because, of course, it is really hundreds of diseases and it can do many, many different things. I enjoy problem solving. And so obviously there's the sort of protocols where everyone does what they should do and everyone sticks to them doing it in the normal way. But actually it's when things sort of veer off those protocols that as a consultant, you really sort of come into your own. And I enjoy that sort of looking at a situation, working out the best way that I can intervene, the best way that I can help people in doing that. And then the last part of it is the technical side. So radiotherapy in particular is a very technical specialty. It's to do with physics, it's to do with 3D understanding. It's to do with, you know, how do you really give the best person, give the person the best results, you know, without causing too many side effects. And I just enjoy that challenge. So really, there are two main aspects that I particularly enjoy about my job. One is the sort of problem-solving aspect. So I see a lot of patients who've seen other doctors and really have found that they don't have a solution. So, for instance, they might come with a certain sort of pain. They've seen doctors, they've tried painkillers, they've tried injections, exercises, and the next thing that they're going to try is surgery. And they come to me and they say, look, you know, I really don't want to have surgery. Is there something you can do that's less invasive, that's going to get rid of my problem and get rid of my pain and get me back to normal function? And the answer is actually yes, I do have a treatment that can help these people. And that's very gratifying to be someone who has a solution that other people don't have. And in particular, I like doing things that aren't particularly known about. So, you know, my specialty now is treating people with radiotherapy for non-cancer conditions. And this is not something that has a big sort of tradition in the UK. And I've really worked up a great interest, and I've gone to Germany to learn from people who've done it for many decades and have a lot to teach. I love being on the edge of what medicine can do. I love doing new things. I love having knowledge that other people don't have. I love being able to help in other ways, in ways that other people can't do. You know, for me, that's really something that stimulates me a lot, being innovative, inventing new ways and doing things in my own way. So I'm a very calm person. I'm a very logical person. You know, so when a patient comes to see me, I do want to know a little bit about them and particularly what makes their life good. So what do they value about their life? What do they enjoy doing? You know, what is it that the problem they come to me with is getting in the way of doing? So, you know, for instance, for some people, it might be they've got some pain in their foot. They really love doing a lot of walking and now they're not able to walk so much because they've got pain, that sort of thing. And so really getting to the crux of the problem in a medical way, but also how it relates to their life. So that's the first thing that I will always do. And then I like to go through things in a very logical way. You know, how can we help? What can we do? What can't we do? And then what I like to do is really work up a plan collaboratively with the patient. So I don't like it when people say, this is what you've got to do, and I'm the expert, and, you know, this is the plan. It's, look, this is what I can offer. I can understand if maybe you want to do this or maybe you don't want to do this, but this is what I can offer. What do you feel comfortable with? How do you want to take things forwards? Do you want to think about it a little bit more? Is there anything else you want to ask? And I find that that's the way for me that the consultations go best, when we really have a conversation rather than a sort of paternalistic way where the doctor tells the person what to do. So, I really like to work things in a collaborative way, in a calm way, in a logical way, and reach the solution together.